data collection event. So Dr. Wesley, you please take the floor. Hezron, do you want to add anything?
Not really. I think we can just go ahead with Dr. Wesley's presentation.
Yeah, good evening. I think, good evening, everyone. My name is Dr. Wesley Oga. I work in the Ministry of Health in the Division of Health Informatics. And mainly today, I am to take you through, for the pharmacists who are around, the tools that are used for purposes of reporting on any of our data that we are able to deliver. So my first thing I'll be able to take you through is that if you see my screen, kindly confirm.
Yes.
Good. So we have a pharmacy reporting portal, and the pharmacy reporting portal, as you can see, the URL up there is pharmacyreporting.health.go.ke. And this is an instance specifically for pharmacy or community pharmacies that are out here that are offering family planning, and they're able to report on a number of things. And today, I think I'll be able to take you through what they're able to report. So normally when you land on this particular page, the first thing is that you need to get credentials to be able to log in. And in case you need credentials for your particular pharmacy, I'll be able to share my email at the chat side at some moment. And you just need to request and tell me which particular pharmacy you work in. If you have these tools with you, and you can be able to report. So the crucial thing is that a number of registers are printed, and I think a number of pharmacies, community pharmacy individuals have been trained on it. And at the end of the month, they're able to do a summary. And when they're doing a summary, this is where they'll be able to enter their data. So we're going to click on the far right. You can see the summary apps. Then we click data entry. So when you come to data entry, it will be able to load specifically your pharmacy. Being that I'm a national administrator of the system, I'm able to see the whole of Kenya. But you'll be able to see clearly that, for example, if I open Kenya, I open Baringo Central, and a particular ward, you can see a number of chemists here. Betty, Chemo, Kemusian, and the rest. So for you individually, you have to get your user right. You'll only see your particular pharmacy, or should I call them chemist. Allow me if I switch through both terms kindly. So for example, if it's Beltrex, you'll be able to select Beltrex, and immediately you select it on your right, the organization unit, which is your chemist, will be able to appear here. You can see with the registration. A disclaimer here is that pharmacies that are within the system are pharmacists I got from the PPB. So you need to be a registered pharmacy for you to be able to report on this. On matters of why, I think that is for another forum, not today. So the two tools someone is able to report on. Someone is able to report the summary of the services, which is the 711 integrated summary report. Then there's something about facility contraceptive consumption and report and request. At some point, if I am right, the division of RH had requested for some funds from government, and government had decided that because of the issue of family planning, they would be able to supply some of these private chemists with family planning commodities. They could only be able to charge a small fee for delivery of that particular service, maybe for the injection or whatever amount they have to agree with. Then there's the MSF summary. So we'll just begin with the integrated summary, and then you select the period for which you're reporting. A key thing to note is that you can only report for a completed month. So for example, December will not appear here until the 1st of January 2024. If you pick November, that is what you'll be able to see. Now, key to remember is that one of the few things that we really monitor is the first new clients, people who are first ever users of contraceptive. And for this, you'll be able to enter on all these areas you're seeing here: first users of pills, combined oral contraceptives, emergency pills, all the way to male condoms and female condoms. Although I don't know if you can really get new users, but it's important as a system, as a program, to be able to know that who are the new people and who are the revisits. It's a crucial thing when you do calculating something called couple year protection, so that you're able to know how well or how bad we're doing as matters pertaining from the planning. This will be data you'll be able to report for us. Then the next thing will be long acting. As you can see, all the long acting is inactive. This is because in our system and our training, the agreement was that this implant and the rest can only be inserted at a clinic setup or rather on a health facility setup. So this cannot be done on a walk-in person coming into the chemist. And the same thing for ICD, IUCD removal and implant. So the last thing is that you need to enter this data. I think in our current setup of Kenya, you are all aware of the teenage pregnancy. So the law notwithstanding, we need to know those between the ages of 10 and 14, 15 and 19, 20 and 24, and about 25 that are receiving that particular family planning service from the service delivery point. This is a crucial case, although it is one of these oxymoron we have as a country, that it is expected between 10 and 18 should not be having sex, but on the ground things are very, very different. I think you may be aware. Then the next thing you'll be able to report on is on the family contraceptive and consumption. This was to report the commodity, and I think it looks very much like the commodity tool that is used to report in our system. So this was to inform the sub-county pharmacists who are supposed to supply this chemist with this particular FP commodity, but I believe this did not manage to take over, either because of the government did not allocate the 2 billion that was to be given to this particular project, and unforeseen circumstances. That's what I can say. But this is generally what you'll be able to report on commodity, and I think most of you are familiar with it. Is where you enter the commodities that you have, the opening balance, what you received, what you dispensed, what are your losses, your adjustments in case you share out to another pharmacy or the other pharmacy lends you some, your ending balance and what you have requested. So this has yet to pick up. And the last one will be this one, malaria case summary, although this is only being piloted in Kakamega. I have to give you a disclaimer. So there are some chemists within Kakamega that are able to report malaria case summary. Now, generally, if you look at how our reporting has been in Kenya, if you look at the reports for this year, a good number of us are not doing very, very well, because if I select this data set for this year, it's not very encouraging. And you can see, for example, only 13 in Uasin have reported, 1 in Meru, 3 in Kajiado, 4. And basically most of these other counties, despite the training which we have done, have really reported within the system. So you can imagine for this year, we expected 96,420 reports. We only have 23 so far in the system. So mine is to encourage all pharmacists who are here who might have a pharmacy or other community pharmacy, and you need to report. We really need to show our service delivery, especially on matters family planning. So as such, the data is quite little, and there's literally very little I can be able to show in terms of data visualization. And unless there's a question, I would probably move forward and use the normal routine reporting so that I can show people a few visualization. Is that okay?
Yeah, that's okay. We've not received any questions so far. Dr. Wesley, I don't think we can hear you.
Sorry. I think I forgot to unmute.
Yeah,
So
but there's one question so far, but maybe you could tackle it once you're done. It's just Dr. Kenneth is asking, how does a pharmacy get MFL code?
Now, let me just respond to that very fast. The master facility list code is very essential, especially for those who are looking forward to tapping into the social health fund. which the president is launching and should be able to begin in 1st of January. And the procedure is that you need to get in touch with your sub-county health records and information officer. They're usually available at the MOH. There is a pre-filled form. There's a form that they'll be able to come and carry out an inspection of your premise. And once they have been able to fill up all that form, they'll be able to upload it into the KMFL, which is the Kenya Master Health Facility List. And once that is done, you'll be able to get an MFL code. And once with an MFL code, you can now be part of the Social Health Insurance Fund, and you can be able to claim part of whatever drugs you have given someone at that particular juncture. So as I was saying, the pharmacy instance has very little data. So you'll allow me to use the hiskenya.org, which is our main routine data, to be able to show you the different visualizations that you can be able to work with. So the first thing is you need to click on the right corner where we have something called the applications. And once you search for something called data visualizer, and the data visualizer is what you'll be able to use to give you any visualization that you want to look at. Now, the landing page looks something of this sort. And the first thing is you need to be able to pick what kind of visualization you want to see. So these are all the kind of visualizations available in our system. We have a pivot table, column, stacked bar, line graph. Each of these can be able to show your data depending on the suitability and the data that you're able or you're looking at. So allow me to start by using the pivot table. And maybe you can just try and visualize the number of skill deliveries in Kenya so that you can be able to see how the data is visualized. So the data we want to see is total skill delivery in Kenya. So I'll click on this area written data. I'll either click on the left or I can click on the right. And total delivery is usually an indicator found in a group called safe delivery. So total deliveries. Now, anytime whatever you want to visualize, you need to push it to the right here, where it becomes a selected item. This is what is available for you to visualize, and the far right is what you've been able to push. The next thing is you need to be able to pick the period. Which period do you want to see this data? A good example is that by default, the system selects the last 12 months. So I'll just let it be at that, but in case you're looking for data for a specific period, come to fixed period, and you can either pick a month, a year, yearly, or whatever, quarterly, 6 monthly, according to a financial year. Those of you who are familiar, some organization, their financial year starts in October, some start in November, or ours, in our case, starts in July. So I'll just let the last 12 months remain there. I will hide. And the next thing is I need to pick an organization unit that I want to see that particular data. So for example, if I want to see data for Kenya, I just click Kenya, and once I click update, these here are the deliveries that are happening in Kenya month by month. So you can see, for example, November, we are quite low, but I need to inform you that data is still coming in. Data is allowed to be entered until the 15th of every month. So these are basically the deliveries that have been happening in Kenya. In case I want for a different organization unit, maybe someone is interested in Homa Bay, I just click on Homa Bay, and once I click update, it should bring me that particular data as it is as a fit for Homa Bay. Sorry, I forgot to check Kenya. So you can see Homa Bay, generally the deliveries are about 2,600, and they are about all through the month. So once you've done this, the beauty about DHIS, it allows you to visualize this same data in a very different way. Maybe I want this data as a column graph. I just select column, click update, and I think you can all see clearly that, let me move this up here. Sure. So you can see clearly it gives you that particular data, and it tells you Homa Bay, these are the deliveries per month and how many they've been. In case I want that data again, if again I want that data as the bar graph, I just click on bar, and I'll be able to click update, and then you can clearly see So it will allow me to play around the different dimensions. If I want it as a line graph, I just click line, and you can see that data is visualized as a line graph. In case I want this data maybe for purposes of downloading, to use them in an abstract or whatever format, you can see up here the summary thing download. Once you click download, it will ask you which format you want to download it, either as an image or as a PDF, and then that will allow you to be able to download it. Different visualization options go on. You can decide you want it as an area. Again, it will give you that particular one. So it's you getting to know what is the suitability or what is the audience you're working with and how particular that data you want to see. I think I've been able to show you clearly that all this, if you want it as a pie chart, just do the same. And it will just give you one because a pie chart is good for only one time period. And in case you need it as I think I've gone through most of it. So probably what I would like us to see is, in case we have this data and we want to see it in a year by year. So let's select, for example, a period. We want to see last year and this year, how does that particular data appear? We will be able to pick 2022 and 2023. So we hide and then we pick the option, but we want to see this data year over year. And once we update, it should be able to give a good comparison like that. So you can see generally 2022, the deliveries were quite low in Homa Bay. They have gone up this year. They're quite high, as you can see. In case I want to see for Kenya, I'll just come back here, remove the Homa Bay.
Dr. Wesley, I think
Yes.
The screen is frozen. I don't know if you're on a different page right now or still the same. Yeah, I think it's now clear.
Okay. I think I made a mistake and paused the share. So what I was saying is that the system allows you to be able to do a year over year and compare different years. So for this particular one, I've said just look at the deliveries for Kenya, where 2023 is in green and 2022 is in blue. And so you can be able to clearly see. I think generally looking at it, you can see, I don't know if this year we're giving birth more or less, but that gives you generally a trend of what is happening. So all this visualization will be dependent on the kind of data you have and which your audience is for which you're trying to look at. I believe this is the much I can do for the moment, being that it would have been more easier if we had more pharmacy data. What I tend to have now is routine data. Thank you.
All right, thank you. Thank you so much, Dr. Wesley, for taking us through that. For participants, do you have any other questions that you'd like addressed? So I'm seeing Dr. Farida is asking if you could kindly repeat on how to get the MFL code. And then there's also a question asking, how do we move from the bar graph to the line graph? Dr. Wesley, maybe you could tackle those two.
Good. So I will go again through the MFL code. Now the work of giving an MFL code is devolved. So it happens at the sub-county. So within the sub-county, we have a sub-county health records and information officer. And this sub-county health record and information officer is the one mandated to adding of facilities for them to get an MFL code. So you will approach your sub-county MOH, vision where the health record sits, and you'll be able to fill a form within them, requesting them that to come and inspect your facility for purposes of getting an MFL code. So we have already prepared checklists, which a team from the sub-county will come, and together they'll be able to assess your facility, your staff, and the kind of stuff you have, what is available, your infrastructure, and all those things. And once they have been able to capture them, they'll come and load them within the system. The county HRIO will be able to validate, and someone within the national, depending on the region, like I personally cover Western region, I'll be able to approve. And once the approval has gone through, you'll be able to get an MFL code. And this is quite crucial for those who want to look forward into tapping into the social health insurance fund. In case you do not have an NFL code, you'll not be able to get your rebates back because you're not recognized as a health facility or a health registry as someone delivering health. Now, the other one I've been asked is, I believe my screen is still being shown.
Yes, I think it's because that part is where the screen was frozen when you are shifting from the bar graph to the line graph.
So what I was saying is that once you click here, whichever visualization you might want, all you need is to select that particular visualization. For example, let me say I want to compare this as column. I select the column and I just click update. So, sorry, I was working online, but generally that is it. You pick whatever visualization you would want to see this particular data. And once you picked it, like this one, then you update, the system will automatically change whatever data you have selected, whatever visualization that you want to see. What is important is to get to know which visualization is good, which particular data. A good example is, as I said, pie charts are only good if you are doing a cross-section of data at a particular point and juncture. They will not be able to cover for time. Bar graphs and column graphs are very good for data that is covering a period of time. But the only challenge would be if some of the data tends to be very, very small. So it will only appear as a very small thing down on the bar graph, and it will not be able to give a very good representation of sharing. Thank you.
Right, thank you for that. I see we have a couple of questions that have just come in from Dr. Lucy, who's asking what kind of pharmacy data is being collected apart from FP and malaria?
Now, at the moment, those are the two programs that have worked towards ensuring that they get data that is collected from the community pharmacy. The other programs have not been able to do it. And so we await once they develop tools and they really want that data collected from the pharmacy, community pharmacy, we as a health management information system are more than ready to customize the tools and make them able to report within the system. So at the moment, the only proposal we've got is from RH, reproductive health, and the malaria. Thank you.
All right, thank you for that. And then the other question is from Dr. Anita, who's asking what aspects of decision making is affected by the lack of data and how does it impact care?
Now, a good example I'll give you is that at the moment, our reporting for family planning is very poor because as it is in Kenya, our first point of care for most of the family planning, especially for the age that is very active, tends to be the pharmacy, for the community pharmacy. I think I don't need to belabor the point. All of you are familiar with how much P2 we sell during every Monday morning or every Friday evening, or whatever time. So as such, what is captured as our need for family planning tends to be very big. Whereas in the real sense is that we have a good number of our people accessing and getting this family planning, only that we do not have the data to show it that there is care being given or the family planning uptake is high, only that it's being done at the pharmacy level. So that means generally as we are planning as a country, we're planning with even say half the data. And even when we're doing our modeling and everything, we do not, our data is not rich enough to be able to give us a good perspective of what we're going to do or what is happening. And that is becoming a very big issue. And that's why, as you've heard, our president has said universal healthcare from 1st of January, everything will be free. So the issue is that cost implication, if that is what is making people not report or not go to health facility, should be a great turn so that we'll be able to see data coming in and will be able to help us as a country plan very, very well. I hope that answers them.
Yes, that answers. Thank you so much. Maybe just the last one is someone is asking, is the data visualization limited by rights issued to the person or not? I believe he's speaking about this slide.
Yeah. I think one of the few things I've realized is that most of the time when the rights are given at the lower level, they're not able to be given rights to see the whole of Kenya. So the data visualization is available for every user. The only challenge is if you have access to seeing Kenya, because sometimes when you're given rights by the sub-county HRIO, they tend to limit you within your own sub-county, and that becomes a very, very big challenge. But in case you want to see Kenya, you can just do a mail. I'll be able to share my mail at the live box so that anybody who needs assistance to access or getting a higher view of the visualizer, I can be able to adjust your viewing rate so that you can be able to see Kenya. One thing we're encouraging people is that you should be able to view every data in everywhere in Kenya so that you can also see what is happening across the country, and you can compare yourself and see if you're doing very well or not.
All right, thank you so much. I think all the questions have been answered. So I see a comment from Dr. Silvia Opanga who says we'd love to have this presented at the conference. So maybe, Dr. Wesley, that's something you could consider.
Sure,
Next
I
year.
would consider that. There's no problem. I think that's now me for my homework. Thank you.
All right, thank you so much. Thank you so much for the presentation and the support you've continuously given PSK during this family planning project. So we have an announcement that I'd like to make. We are currently looking for pharmacies that are being run by pharmacists in Nairobi, Kiambu, Kajiado, Narok, Meru, Kisii, Kisumu, Nakuru, and Uasin Gishu for a project. So if you're currently running a pharmacy in these regions, kindly send your contact details to the PSK office, and then we'll reach out to you. And some of the information that we'll need is the name of the pharmacy, the phone number, name of the pharmacist, the registration number and email. And of course, one has to be a member of PSK. So kindly take note of that. Also reach out to your colleagues and let them know about that. So as we close, I'd like to welcome Dr. Mungoma to just maybe give some comments about this second session that you've just had. Dr. Mungoma, if you can hear me. Dr. Mungoma. All right, I think
yeah, you can hear me now?
Yes, you can hear you.
Yeah, thank you. I think there was a change there from whatever I was to a panelist. Yeah, but I've been very attentive the whole evening, and one, I just want to say thank you so much for the earlier presentation from the formidable team that are putting the whole conference together. I think they're really doing a good job, and we really need to support them and make sure that this is a good quality conference, keeping in mind that it's an international conference as well. I really want to thank again Dr. Wesley from the Ministry of Health for his continuous support and his involvement in ensuring that pharmacies continue to appreciate the value of reporting and the power of data. I know that our focus on family planning, however, as was mentioned there, that other commodities and other programs are also coming in like malaria. So it's not just about FP when it comes to data visualization, but it's all about how the private sector contributes towards the whole reporting and supporting, forecasting, supporting, the whole supply chain management in the country. The private sector is a very, very powerful sector, and it's something that government continues to appreciate. Over and above that, again, I also want to encourage everyone to think about publishing in the PJK, that's the Pharmaceutical Journal of Kenya. I know there are a lot of graduates out there. There are people doing postgraduates. There are people collecting data where they work, whether it's private pharmacies or even in research institutions. You could put that data together, come up with a manuscript and publish in the PJK. You can get further details about this from the office. Besides that, again, thank you so much, Hezron, and the good work that you continue doing in holding these webinars. Thank you.
All right. Thank you so much, Dr. Mungoma. So as we close, I'd like to just remind you, kindly ensure that you subscribe to this event on the PPB portal. The name of the event is Abstract 101. So you can use that keyword, Abstract 101, and you should be able to get that event on the PPB portal. And also just a reminder that we have the tree planting, Zumba, and our nature walk activity this weekend. So for those who would like to join us, kindly ensure that you fill in the form that has been circulated. So I think this is where we'll end. Thank you all for joining and for all the speakers for this session today. Have a good evening.